والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Immunization by Professor Mahmoud Hani Sulaiman. At the beginning, we will discuss the immune system. Structure and function of the immune system. Tissues and organs important for immune function include cells derived from stem cells, liver and bone marrow. Cells stored, multiply, interact, and mature in thymus, spleen, lymph nodes, blood. For transport, there is lymphatic vessels. Accessory organs are appendix, tonsils, and intestines. Immune system protects humans from infection with layer defenses of increased specificity. So, it is composed of many layers. First, physical barrier. Prevent pathogens as bacteria, viruses from entering body. Physical barriers. If pathogens pass these barriers, innate immune system provides an immediate but non-specific response. So innate immune system provides an immediate but non-specific response. However, if pathogens avoid innate response, a third layer will deal with antigen. It is adaptive immune system. This contains response to infection to improve its recognition of pathogen. This recognition retained after pathogen eliminated in form of an immunological memory and allows adaptive immune system to deal faster and better each time this pathogen is encountered. Antigen. Antigen equals substance on entering body stimulates production of specific antibodies and combines specifically with this antigen. Best antigens are proteins, e.g. diphtheria toxin, tetanus toxin. Others are polysaccharides, e.g. blood group antigens, lipids, and nucleic acids. There are incomplete antigens called haptens. Alone, they are not antigenic but can provoke an immune response by combining with one of body's proteins. So, protein becomes foreign to body, e.g. penicillin is a hapten. On contact with antigen, hosts respond in three ways: circulating antibody formed. Second, delayed type cell mediated hypersensitivity reaction result on second contact with antigen. Third, tolerance. On second contact with same antigen, no response will be provoked. Type of response in each case depend on antigen itself, dose, route of application. Antibody. Antibody equal protein produced by body due to invasion of antigen. Antibody can react specifically with same antigen and lead to its production. Sites of maximum formation of antibody are lymph nodes and spleen, a smaller collection of antibody producing cells widely scattered in various tissues in body. Plasma cells also produce antibodies. Antibody may be antitoxic as diphtheria and tetanus, antibacterial like typhoid, or antiviral as polio. Immunoglobulins. These comprise of families closely related globulins synthesized by cells of reticuloendothelial systems. Human immunoglobulin system is divided into 5 major classes: IgG, IgA, IgM, IgD, IgE. كلمة جامد. Molecules of each Ig consists of kappa and lambda polypeptide chain. IgG. Repeated exposure to antigen lead to antibody accumulation in serum reaches about 80% of serum antibody in adult. Antibodies to gram-positive pyogenic bacteria, antiviral, and antitoxic antibodies found exclusively among IgG globulins. IgG cross placenta. Maternally derived IgG is slowly replaced by actively synthesized IgG. This appears 1 to 3 months of age and then rapidly increased. Adult level reached by age of 1 to 2 years. Normal adult serum level of IgG is 600 to 1800 milligram per 100 milli. IgA. It contains isohemagglutinins, anti-brucella, anti-diphtheria antibodies equal about 10% of serum antibodies. Saliva, colostrum, tears are relatively rich in this fraction. Nasal and bronchial secretions, bile, intestinal juice, prostatic fluid also contain IgA. It plays a decisive role in local immunity. IgA synthesis begins 2 weeks after birth. Normal adult serum level is 70 to 380 milligram per 100 milli. IgM have high agglutinating and complement fixation ability. Wassermann antibodies, bactericidal antibodies against gram-negative organisms, endotoxins found in IgM. It equals about 5 to 10% of serum antibodies. It cannot pass through placenta. Normal adult serum level is 20 to 130 milligram per 100 milli. IgD. Not much is known about it. Normal adult serum level is 4 to 40 milligram per 100 milli. IgE has ability to fix themselves firmly to tissues. So they fix themselves firmly to tissues and remain so. They are likely to play an important role in allergic reaction. IgE allergic reaction. Immunity. Immunity defined as ability of an organism to recognize and defend itself against specific pathogens or antigens. Again, ability of an organism to recognize and defend itself against specific pathogens or antigens. Types of immunity. There is a specific and non-specific types. Non-specific either First line of defense, which are skin, mucous membranes, secretions of skin and mucous membranes. Second line of defense, phagocytic white blood cells, antimicrobial proteins, the inflammatory response. The specific mechanisms include immune system, which is present in lymphocytes and antibodies. Types of immune defenses. Types of immunity. Immunity either innate or acquired. Acquired either passive or active. Passive in the form of artificial or natural, active, artificial or natural. Comparison between active and passive immunity. Here I will read only the active immunity column. Why? Because to remember such a table, you concentrate on one type and the other will be known. So, active immunity, usually produced in response to bacteria, viruses, toxins, or toxoids. Body cells take an active part in the production of immunity. It takes some time to develop the antibody in the system. Immune lasts long, used for pre-pathogenic prophylaxis and treatment of subacute or chronic infections in order to increase the immunity. The other column, passive immunity, is reverse. And this is how to understand and remember such a table. Types of immune response. First action with antigen is known as primary response. Reaction with same antigen causes a secondary response that is more rapid and powerful. It will be explained in later figure. Immune response depends on nature and dose of antigen, route of administration, type of adjuvants used, nutritional status of recipient. This figure shows the immune response. On first exposure on the left side, the arrow will, on first exposure, after a time, the response will happen. This is called primary immune response. It will contain antibodies against antigen A. After second exposure here, the second curve, the second wave is called secondary immune response to antigen A. It is, as is indicated, as it is shown, higher and rapid. So it is rapid just when the antigen is introduced. It gives antibodies and higher than the first response. During this response, secondary immune response to antigen A, another antigen B may be introduced and will begin another two waves. So it is specific. What this relates to preventive medicine, the relation is immune response to vaccination. Vaccine is an antigen, okay, but without pathogen, but without risk of disease. So consequent immune response manifested by antibody humoral immunity or cell-mediated immunity, or both. When you give a vaccine, either humoral immunity or cell-mediated immunity or both. Maternal cell-mediated immunity not transferred to fetus. This is why BCG given at birth, OPV given by mouse. Why? Because it establishes local infection in proportion of children. Hepatitis B vaccine is excellent immunogen, overcoming inhibiting effect of maternal antibody. Hence, it can be given at birth. But live measles vaccine inhibited in presence of maternal antibody. Live measles vaccine inhibited in presence of maternal antibody in infants. So it is given after a delay of 9 months from birth, and MMR, which contains measles, also given only after 12 months. Goal of all vaccines is to promote a primary immune reaction. So if organism gain antibody, it will lead to a much stronger secondary immune response. This is important. The goal of all vaccines. This is important. Any subsequent immune response to an antigen called secondary response, and it has the following features. It is shorter, more rapid, higher response, more specific or better response to invading antigen, utilizes IgG instead of large multi-purpose antibody of IgM. So it is shorter, more rapid, higher level, more specific or better response, utilizes IgG. Types of vaccines. Traditionally, 4 types of vaccines will be explained in the coming table. These 4 types of vaccines: live attenuated, inactivated, toxoids, subunit, and recombinant. Live attenuated, either bacterial, viral, or rickettsial. Rickettsial, epidemic typhus. Bacterial, BCG, typhoid, oral typhoid, plague. So bacterial, BCG, oral typhoid, plague. Viral, R, viral live attenuated, we are in the live attenuated. Oral polio, yellow fever, measles, rubella, mumps, influenza, and chickenpox. Toxoids, bacterial, either against diphtheria or tetanus. Inactivated or killed vaccines, either bacterial or viral. The bacterial ones: typhoid, injectable; cholera, pertussis, meningitis, cerebrospinal meningitis, and plague. The viral ones are hepatitis A, hepatitis B, rabies, Salk, polio, which influenza, and Japanese encephalitis. I put this table, dose and route of administration for selected vaccines, to see that different vaccines have different doses. Okay? And on the right side, the rectangle in red around intranasal spray, here intranasal spray, to see that there are vaccines that may be not injected. Here it is intranasal. Okay? And you can write this table or print it and put it in your file. I put this also, you can write it or print it and put it in on the file. But remember, there is different types of administration here. For example, subcutaneous, intramuscular, and so on. And there is a vaccine for rotavirus called RV1 or RV5. Its dose is 1 or 2 millis. It is oral. And here is herpes zoster virus. This is the dose. So you must read the insert of each vaccine before giving it. This is the dose, 0.65 ml. It is different from other doses. Please print this table and put it in your human immunoglobulins. Human immunoglobulins are given in some infectious diseases. They are either specific or normal immunoglobulin. The specific immunoglobulins are three: hepatitis B, varicella, and diphtheria. Human normal immunoglobulin are hepatitis A. These immunoglobulin can be given in hepatitis A, measles, rabies, tetanus, mumps only. Human anti-sera, they are either viral or bacterial. Viral, rabies; bacterial, diphtheria, tetanus, gas gangrene, and botulism. Here I put جدول التطعيمات الإجبارية للأطفال في مصر. Compulsory vaccination for children in Egypt. It is for you to write or print this and put it in your file. Also, this is our additional vaccination, التطعيمات الإضافية للأطفال. Write it, print it, and put it in your file. Other additional hepatitis A and seasonal influenza. All these are present in Egypt. Because please write or print it and put it in your file. Now we are going to tell you about general guidelines for vaccine administration. There is a must. You must insert consultation. You must consult the insert. Insert consultation is a must. The package insert should be consulted for manufacturing date and expiry date, nature, the components of the vaccine, content. It is not only the vaccine adjuvants are found. So the nature, it is killed, or heat killed, or phenol killed, or whatever it is, live attenuated, and so on. Content, contraindications, side effects. It is like any drug. It has contraindications and side effects. Storage, how to store the vaccine, and administration. Multiple doses. If series is interrupted, continue as if it had not been interrupted. If a vaccine have many doses and the series is interrupted, you give a dose and the child did not come to your clinic at the correct time with his parents, of course, continue as if it had not been interrupted. Do not count as part of primary series, doses given at less than recommended intervals. Again, his parents brought him to your clinic earlier. Give. Why to give? Because we don't want to miss opportunity for vaccination. But do not count it as part. Simultaneous administration. Inactivated vaccine given at separate sites. Okay, inactivated vaccines given at separate sites. Live attenuated viral vaccines given on the same day, otherwise at least 1 month apart, 1 month between them at least. Inactivated and live attenuated at same time, except cholera, yellow fever, separate them by at least 3 weeks. Administration of immunoglobulin and vaccine. If we have to give for a certain disease immunoglobulin and vaccine, what to do? Inactivated vaccines have large antigenic load, do not require multiplication in body, so can be given any time after immunoglobulin. So inactivated vaccines given at any time after IG, if given simultaneously, must be at different sites. Live attenuated viral vaccines have a small antigenic load, require multiplication in body, and cannot be given with IG. Live vaccines should not be given for at least 6 weeks, better 3 months, after administration of IG. Again, live vaccines should not be given for at least 6 weeks after administration of IG. If IG has to be given less than 14 days after administration of live vaccine, vaccine should be repeated after 3 months of IG. IG does not interfere with oral polio or yellow fever. Reactions to vaccine components. Egg hypersensitivity. Some vaccines like yellow fever, measles, mumps, influenza are grown in embryonated chicken eggs. Any vaccine grown in embryonated chicken should not be given to anyone with known anaphylactic hypersensitivity to eggs. Preservative hypersensitivity. Some vaccines contain preservatives like thimerosal, mercurial preservative, or neomycin, MMR, and varicella. They should not be given to individuals who have anaphylactic reaction to these agents. Yep. Any individual have anaphylactic reaction to these preservatives should not be given MMR or varicella. Penicillin allergy. No currently recommended vaccine contain penicillin or its derivatives. Therefore, a history of penicillin allergy is not a contraindication to immunization. Immunocompromised individuals should not be given a live attenuated vaccine except HIV. You can give MMR. Except HIV, you can give MMR. Since recipients of oral polio vaccine excrete vaccine strain in their stool, OPV should not be given to individuals who live in households with immunocompromised hosts. Again, OPV should not be given to individuals who live in households with immunocompromised hosts. Also, OPV should not be given inside the walls of a hospital. It should not be given to a patient inside the ward. If he has to get this vaccine, give it to him after he leave the hospital at the outpatient clinic. Severe febrile illness should not be immunized till completely recovered, primarily to avoid blaming a vaccine for manifestation of underlying disease. Pregnancy and vaccination. Live attenuated vaccines should not be given to a pregnant woman or to those likely to become pregnant within 3 months. Live attenuated vaccines should not be given to a pregnant woman or to those likely to become pregnant within 3 months of receiving the vaccine. Pregnant women at substantial risk of exposure may receive live viral vaccine when possible during second or third trimester. There is no evidence that inactivated vaccines or IG poses any risk to the fetus. In fact, women completely immunized against tetanus should complete their primary series during the last trimester of pregnancy. Children of pregnant women should receive age-appropriate vaccination. Misconception about contraindication. The following are not reasons for delaying vaccine. Soreness, redness, or swelling at site of injection, or temperature less than 40 degrees centigrade in reaction to previous DPT. Mild acute illness with low-grade fever, mild diarrheal illness in a well child, current microbial therapy, convalescent phase of illness, pregnancy of household contact. The following are not reasons for delaying vaccine. Prematurity immunization should be given on basis of chronological age. The vaccine dose should not be reduced. Recent exposure to communicable disease, breastfeeding, history of non-specific allergy, relatives with allergy, family history of convulsion. International vaccination requirement. Immunization against yellow fever. Yellow fever is endemic in tropical regions of Africa and South America. Africa and South America. Vaccination is the most effective method for prevention of disease during international travels. Two types of vaccines are available. 17D vaccine. This is the approved vaccine for international travel. The other one is not approved for international travel. So 17D vaccine. It is a live attenuated, chick embryo grown 17D strain freeze-dried vaccine for storage at WHO approved centers. Vaccine kept for 3 months at plus 4 degrees centigrade. If storage is for a longer period, temperature of minus 25 degrees centigrade is to be maintained. After reconstitution, it should be used within half an hour. The CAR vaccine, also called the French neurotropic vaccine, developed at Pasteur Institute. It is thermostable and can be easily transported. However, it has produced post-vaccine encephalitis in children. WHO has not approved use of this vaccine for international travel. Administration of yellow fever vaccine. 17D vaccine given subcutaneously at insertion of deltoid in a single dose of half milli. Immunity begins in 10 days and lasts for 10 years, but persistence of neutralizing antibody 30 to 35 years after immunization with 17D yellow fever vaccine was observed. Yellow fever vaccine available at centers certified by government. International certificate of vaccination is required only for yellow fever. Period of validity of certificate is shown in the coming table. Yellow fever primary vaccination valid for 10 years, valid from 10 days after vaccination. Yellow fever revaccination valid for 10 years, valid at once after revaccination. Immunization in special circumstances. Immunization in preterm infants. All vaccines given as per schedule irrespective of birth weight or period of gestation except hepatitis B. If weight of baby less than 2 kilogram and mother is hepatitis surface antigen negative, then hepatitis B vaccine is postponed till baby weight of 2 kilograms or 2 months of age. يبقى if baby less than 2 kilograms mother is hepatitis surface antigen negative, postponed till he became 2 kilograms. However, if mother is hepatitis surface antigen positive, then both hepatitis B vaccine and hepatitis B immunoglobulin given in 12 hours of birth, followed by 3 more doses at 1 and 6 months. So if the mother is hepatitis surface antigen positive, you give both hepatitis B vaccine and hepatitis B immunoglobulin at different sites and then complete the series. Children receiving corticosteroids. Children receiving corticosteroids at dose of 2 mg per kilogram per day for more than 14 days should not receive live virus vaccines until steroid discontinued for at least 1 month. وفي هذه الآونة لا أجد إلا أن أقول thank you والحمد لله رب العالمين.